Good evening, everyone. Welcome to our assessment for the CAA aspirants, Philippines. We are now on week 7 of Module 2. This is, in reality, the 17th week. Can you imagine? 17 weeks na pala tayo, no? So, without further ado, we would like to proceed with the first 5 questions. Let's call on Ma'am Angel to help us out and give us your answer. Good
Good
evening.
evening, Doc. Good evening, classmates. Number 1. A male patient suffer from bronchial asthma for over 15 years, usually worse during the winter time. The symptoms include difficulty exhaling, a heavy and full sensation in the chest, and cough with profuse thick white phlegm. He has a light pale tongue covered by a thick white coating and slippery pulse. Which of the following patterns apply to him? A. Wind cold attacking the lung. B. Kidney yang deficiency. C. Cold phlegm obstructing the lung. And D. Lung Qi deficiency. So yung answer ko po, Doc, is letter C po. Kasi slippery pulse po siya. So, yung slippery pulse po kasi damp or phlegm. Tapos, thick
So
white coating, wind.
wala doon sa ibang options, no?
Yung wind, oh yes, Doc. Wala po, Doc.
Okay, Ma'am Angel, pag
Doc.
yung diagnosis mo is wind cold attacking the lung, ano ang magiging itsura po ng tongue?
Yung tongue po is yung sa may thick white
May
coating
makikita
po
ba
siya.
tayong pagbabago pag wind cold attacking the lung? Remember, this is wind cold.
Wala po masyado, Doc.
Actually, wala.
Wala po. Yung coating lang kasi,
Okay.
Doc.
Ano sa palagay mo ang magiging pulse pag wind cold? So this is wind cold invasion.
Slippery pulse, Doc.
Will you expect slippery pulse pag invasion? 'Di ba pag invasion exterior pa? So ano sa palagay mo ang magiging will it be like superficial, will it be
Superficial, Doc.
superficial. And pag cold, ano sa palagay mo ang magiging quality ng pulse? Will it be tight? Be
Slow po.
wiry?
Slow po.
Slow? What else? Merong sumagot. Yeah, floating and tight. Very good. Yan ha. Sabi ko sa inyo, do not focus only on the correct answer. Because who knows? Yung revalida natin will be yung hindi yung ibang options dito. What about kidney yang deficiency? Bakit hindi mo ito kinonsider? Una-una, how would you expect the coating of the tongue picture to look like?
Yung kidney yang deficiency, Doc. Meron po siyang
Are you going to have a dry coating or a wet or moist coating?
Moist coating po, Doc.
Mas wet, no? Wet coating.
Wet, yes, Doc. Because it's yang deficiency.
Okay. So, ano po ang nararamdaman ng patient dito? Okay.
May diarrhea, edema, may result. Difficulty of erection and low libido. Tapos meron din siyang lower back ache po.
Itong patient ba dito, ano ba ang nararamdaman? Does the patient feel cold? The patient that we are talking about?
Yes, Doc.
Only during winter time, di ba?
Yes po, winter time lang. Kasi yung winter is kidney.
Okay. Tingnan mo ha. Look at the questions. Itong mga key over 15 years. So kung over 15 years na po ito, definitely this is not going to be invasion. Diba? At saka, gets worse during winter time. So hindi mo pwedeng sagutin kidney yang deficiency because
Yes po.
pag kidney yang
Kasi,
deficiency, kahit hindi winter time, malala pa rin yung pakiramdam niya. And also, ito napaka-importante to, difficulty exhaling. So, kung ang pasyente may difficulty inhaling, what pattern are we talking about? Have you heard
inhaling,
of,
Doc.
ano ba ang role ng kidney sa lung qi?
Ano po siya, Doc? Siya po yung sasend kay lang ng Qi. Kaya ngayon, kung si
Kung
kidney
mahina
may
ang
problem,
kidney,
yes po, nagkakaroon po siya ng asthma. Lalo na po nung makikita po natin
so,
to sa may edad na po.
okay, anong pagkakaiba po ng, ito kasi, sabi mo, cold phlegm, obstructing the lung. So phlegm na siya eh. So very
Yes, Doc.
internal na. So medyo, yun nga, over 15 years, tapos worse during winter time. Anong pagkakaiba po ng presentation ng patient
Um,
sa kidney yang
yung,
deficiency? Sabi mo kung nagkakaedad na, no?
yes po,
Mm. So pag ang isang pasyente nagkakaedad na, alin siya mas nahihirapan, mag-inhale o mag-exhale
mag-exhale, Doc.
pag may edad
Or
na?
mag-in, apo,
Okay, let me 'di ba, the kidney is supposed to anchor the qi, di ba? So pag
apo,
ina-anchor mo, kailangan mo siya i-anchor mo siya kasi 'di ba magdi-descend dapat ang lung qi, right?
yes,
But
Doc.
in a patient, sabi mo medyo matanda na or may kidney qi or kidney yang deficiency, um, mahina na po yung hindi na niya ma-anchor yung lung qi. So what will happen? Ang gusto kong tanungin dito is ano yung pagkakaiba ng clinical picture ng isang cold phlegm obstructing the lung, katulad ng patient ito for 15 years, it's a very chronic
Apo,
problem, or of course chronic din naman yung kidney yang deficiency, di ba?
yes, Doc.
So, ano yung pagkakaiba ng clinical presentation with regards to sino dito ang like nahihirapan mag-inhale? Kasi sabi mo, 'di ba?
Yung,
Yeah.
yes, yung nahihirapan po mag-inhale, Doc, is yung kidney yang deficiency.
Okay. Good. So
Apo,
'yon.
Doc.
So,
Kaya ito po si letter C po is si difficulty naman siya sa exhaling po.
okay. Ano kaya ang clinical ang tongue picture ng isang may lung qi deficiency? Meron ka bang
Um,
nakikita na pagbabago sa coating?
Wala, Doc.
What about the color? So, deficiency 'yan. It will just
Yung tongue, Doc, pale kasi pag deficiency, Doc eh.
okay. So, ano po yung presentation with regards to symptoms if you have lung qi deficiency?
Pag meron ka pong lung qi deficiency, Doc, magkakaroon ka rin po ng blood deficiency.
Blood deficiency.
Opo, tapos,
Bakit
um,
blood deficiency?
kasi parang si Chi kasi, Doc, syempre pag dumadaloy po siya kasabay niya si blood, di ba, Doc? So parang magkakaroon siya ng kung deficiency si Yin, deficiency siya, magkakaroon din siya kung magkakaroon ng deficiency yung Qi, magkakaroon din ng deficiency of blood.
So is there a possibility ng isang patient may lung qi deficiency will also have phlegm?
Yes, Doc.
So, bakit hindi yun ang sinagot mo, lung qi deficiency?
Kasi Doc, yung lung Qi deficiency kasi, Doc, yung description niya kasi, Doc, low voice, may shortness of breath. So, hindi siya difficulty of exhaling.
Okay. This is the difficulty exhaling, no?
Yes, Doc. Yes, Doc.
So, ibig
Hindi
sabihin,
siya basta shortness
merong
of breath lang.
nag-obstruct sa lung. Yun
Opo.
kasi called phlegm. Okay? So, correct answer is letter C. Okay, maraming
Yes.
salamat. Let's go to the next one.
A 67-year-old male patient currently under chemotherapy for his lung cancer. Seek out your help. He suffers from severe nausea and violent vomiting, especially after eating. The vomiting has a sharp and crisp sound. The vomitus is made up of food, followed by clear fluids or green mucus. What is the pathogenesis for his condition? A. Food stagnation. B. Cold dampness attacking the stomach. C. Spleen and stomach Qi deficiency. And D. Stomach Qi deficiency. Si A po kasi, Doc, yung food stagnation po kasi, usual nag-a-arise po yan pagka may emotional disturbance. Kasi syempre pag nagkaroon ng anger, so mag-stagnate po yung magkakaroon ng parang rebellious Qi, ganyan. So si B naman, green mucus kasi, Doc, eh. So hindi ko makita si B doon kasi cold and dampness attacking the stomach. So si green mucus kasi, Doc, is heat. So
Okay.
ang letter C, si spleen and stomach Qi deficiency, hindi
Mhm.
naman po si spleen Qi deficiency kasi kung si spleen ang may deficiency,
Mhm.
so parang ano din to, dampness. So ang best answer ko po is si D, stomach deficiency. Kasi pag nag-chemotherapy tayo, Doc, magkakos po siya ng imbalance sa yin and yang.
Sa chemotherapy, hindi lang
Oh,
hindi lang ang cancer cells ang pinapatay, pati normal cells.
yes,
So we're
Doc, patay
looking,
lahat.
kaya dapat dito natin, kaya patay lahat, nagiging yin deficiency. Actually, pag sinabi mong yin deficiency, nauubos yung nutrition, yung,
Yes po.
nourishment, no? And, uh, and aside from that, of course, kulang talaga yung nawawala na yung coating. So the worst thing
Opo.
that will happen there is na po siya, talagang may heat na, no? So you see, vomitus, and also sa Western kasi pag nagkikimo ka, you kill also those cells that are rapidly growing, and the stomach mucosa happens to be yung mabilis ang ano niyan. Kaya and also yung hair follicle natin. Kaya nakakalbo, tapos nasusuka. Okay? So this is where we can come in, just to probably help out with the symptoms. So with stomach yin deficiency, ano po ang makikita? Ang sagot mo dito is stomach yin deficiency, no?
Po.
Kasi tingnan mo, even the vomiting, this is already a sign that mahina na talaga yung stomach chi. Yung yin deficient na, di ba? Umaakyat.
Opo.
Violent vomiting. After,
Sa chemotherapy
so
talaga.
parang wala na, umaakyat. So, sharp sound. The vomitus made up of food, clear fluids, green. So you're saying this is about heat, no? So talagang grabe
Opo.
impact talaga ng chemotherapy. So, and also medyo maedad na rin yung pasyente, no? 67 years old. So yun. So you have to focus on the stomach yin deficiency. Very good. Let's go to number 3.
Number 3. A 65-year-old female patient has been hiccuping for over 3 months. The hiccup are intermittent and sound slow and forceless. It is induced or aggravated by eating or drinking something cold. Her appetite is very poor. Her tongue is flabby and pale with a moist white coating, and her pulse is submerged, slow, and forceless. What is the pathogenesis of this condition? A. Pathogenic cold attacking the stomach. B. Spleen and kidney yang deficiency. C. Stomach yin deficiency. D. Liver attacking stomach. Si si ano kasi doc, si letter C, stomach yin deficiency. Hindi kasi to ano yin deficient kasi ano na-aggravate siya ng cold food and drink. So ang answer ko po is B, si spleen and kidney yang deficiency kasi may flabby tongue pa siya and moist
Okay.
and moist.
Okay.
Si D naman, liver attacking stomach. Usually, yung pulse niya is wiry.
Okay.
So, yung pulse naman nito, doc, is submerged and slow. So,
Wow.
yung A naman, yung A naman po kasi, doc, is usual may abdominal pain pag si letter A. So ang best answer ko po is si letter B. Kasi, for appetite, sa spleen yun. Tapos may flabby and moist tongue, so yang deficiency.
Kaya napaka-obvious, no? Ito yung sinasabi ko. You should always look at the tongue picture and the pulse, no? So tingnan mo, flabby and pale with moist white coating. Yung moist pa lang, sign of ano na yan, sign of cold, no? And the pulse is submerged, slow, forceless. Okay? So we cannot answer letter A because in letter A, it is an excess condition. Excess pa siya, no? Pathogenic cold attacking the stomach. And we cannot also answer stomach yin deficiency kasi yung coating ng tongue niya meron pa. 'Di ba? Oo, meron pa siyang moist pa nga no? And liver attacking the stomach, hindi naman ganun ka. Okay, although magkakaroon ka talaga ng hiccup, no? Kasi when the liver attacks the stomach, there will be a rebelling of the stomach qi, umaakyat. However, the pulse is not wiry. Okay, very good, Ma'am Angel. Okay, number 4.
Number 4. A 35-year-old male patient complained of loose stool over the last 2 months. The stool looked like duck droppings. He also has dull abdominal pain, frequent loud borborygmi. Yung borborygmi is a rumbling or gargling noise made by the movement of fluid and gas. So pale urine and cold limbs. His tongue is pale and his pulse is submerged and thin. What is the Sangfu diagnosis for this patient? So, yung A, interior cold in the large intestine. B, damp heat in the lower burner. C, liver attacking spleen. D, exterior cold invading the large intestine. So, ang letter B kasi, doc, is damp heat in the lower burner. So, loose stool siya. So, dampness yung ano natin, description, hindi siya heat. So, hindi yung letter B. Kasi kung damp heat in the lower burner, ano siya, hindi siya loose stool.
So ano
letter C
ang
naman,
magiging amoy ng stool pag may damp heat in the lower burner?
may amoy, doc, kasi heat siya, doc So, hindi maganda po yung amoy niya, ng stool niya.
Okay,
So,
what about liver attacking the spleen? Ano magiging presentation?
Si liver attacking yung spleen, nandito naman po tayo kasi si liver, so wiry pulse dapat meron siya, hindi submerged and thin. So, yung pupo niya, doc, yung dumi niya is, hindi
alam mo na,
rin
nakakita ka na ba ng poop ng duck?
Yes, doc, parang basa siya, doc.
Okay.
Na wasak, ganyan. So, nakikita natin dito, ang best answer po is si letter A. Kasi interior cold in large intestine. Ibig sabihin, meron po tayong deficiency of spleen niya. Kasi submerged po yung pulse niya. So may, ang ano ko po, Yun, Doc. Letter A.
Thin pulse. Okay. Hindi po pwedeng letter D, no?
Yes, Doc. Hindi po. Kasi may fever and chills na rin siya niyan.
Okay. Good. Very good. Let's go to number 5. Okay, sir. Dr. Sam, you'll be next, 6 to 10. Sige po, number 5.
Number 5. What do the following symptoms indicate? Depression, crying, poor appetite, belching, plummet sensation, irritability, distending pain in the hypochondriac and costal regions, chest, stuffiness, irregular menses, dysmenorrhea, thin white tongue coating, and with a wiry pulse. A. Liver young rising. B. Liver Qi stagnation. C. Kidney and liver yin deficiency. D. Damp phlegm obstructing the lung. So, kasi Doc, si letter C, kidney and liver yin deficiency, magkakaroon po siya ng heart failure niyan. So, magkakaroon siya ng problem na liver yin deficiency. Si D naman, so parang asthma and bronchitis.
Okay.
Pag irregular menses kasi, Doc, and dysmenorrhea, distending pain in hypochondria, liver Qi stagnation yan kasi blood circulation problem. So, letter B ang answer ko po.
Yeah, and also, pag tinignan mo yung tongue, wala kang makikita sa tongue.
Apo.
Okay. Pag kidney and liver yin deficiency, alam na natin what to see in the tongue, right? Walang coating, di ba?
Apo.
Pag may damp phlegm, alam na rin natin ano itsura. Lalo na pag liver young rising. Okay, maraming salamat, Ma'am Angel. Good job.
Thank you, Doc.
Excellent job. Very well prepared. Okay, maraming salamat.
Thank you, Doc.
So sana tuloy-tuloy na. Meron pa tayong 3 linggo for diagnostics. Okay. It's good to know that all of you are doing well, quite well. Okay, let's now go to Dr. Sam. And congratulations pala. Mukhang okay na yata yung...
Ang alin, Doc? Yung CNP?
Okay.
Yes, Doc. Okay na.
Congratulations. So now we're going to add more sa winning.
Hopefully, Doc.
Yeah.
Hopefully, Doc. So I'm expecting also na
okay.
I will learn more from acupuncture from you, Dr. Webb. Dr. Webb.
Yeah, definitely. So, yeah, hopefully. And sa tingin ko naman, you're all prepared. And I think this technique, this teaching modality works best, no? Di ba pinapump kayo ng husto with all the questions?
Yes.
And given time to actually study them. And what we would like you to prepare is, to prepare yourselves with is yung alignment natin with the medical people in the hospital. And that has actually been the dream of Dr. Palanca. So from time to time, we will be exposing you to terms, medical terms. And I was thinking when we go to the clinics, this is where we get to assess patients using both TCM and Western. So para magkakaroon na talaga ng marriage of the East and West in the hospitals sa Philippines, no? So yeah, let's start, Dr. Sam.
Yes, and itong number 6 parang more on ano talaga to, Doc.
Yeah, very Western. Yeah.
All right. A 38-year-old man with a 5-year history of diabetes mellitus presents with anorexia, nausea, and vomiting. So his urine output has increased significantly over the past 24 hours. He's now starting to experience a vague abdominal discomforts. So his breathing is deep and rapid, and his breath has a rotten, fruity odor. So random blood glucose level is high. So what is the diagnosis? Ang kanyang breathing is deep and rapid, and his breath has a rotten, fruity odor. So parang may problema na sa ano to.
Mm.
May problema na sa digestive system.
Mm-hmm.
Yes, and this is a worst case scenario for diabetes mellitus.
So the answer
So the answer dito, Doc, is itong diabetic ketoacidosis.
okay, we call that DKA.
DKA, yes. So,
LAMP practitioners, let's start getting used to using acronyms, no? Okay,
yeah.
ang tanong, so it's obviously DKA. So you were saying it's an emergency, right?
Yes, Doc.
What is wrong pag may DKA? Like what causes the DKA?
Well, yung
What
pagtaas po ng
happens? Ang nangyari kasi dito, you need kasi insulin to
yes,
to be able to para yung papasok, para yung cells mo will be able to get the energy, right?
convert, yes.
Yeah,
Convert
the
the energy.
problem is walang insulin that will allow the nutrients to get inside the cell. So ang nangyari, nag-produce ng ketones. Kaya tawag dito ketoacidosis. But my question is, where is the ketones? How did the body produce a lot of ketones?
Ito pong hold on, Doc.
Okay, itong ketones, ito yung this is what happens pag yung syempre ang katawan natin will always look somewhere else pag wala siyang makuhang walang insulin that will actually make you use of the energy, no? So pupunta ngayon yung katawan mo doon sa mga fats. Okay? So it will break down fats para gamitin for energy. And this is where you start producing ketones. Okay? So una-una so this is a diabetic emergency. And this is something that everybody should know. Ang tanong ko, ano po yung signs and symptoms ng diabetic emergency? Because this can happen to anyone, no? So first is hunger. Tapos nagka-clammy yung skin niya.
Yes.
Diba? Tapos nagpo-profuse sweating. No? And then what else? Nagkakaroon siya ng confusion or drowsiness. Diba? Tsaka the patient would feel weak or parang mawawala ng malay. At saka minsan hindi na nagre-respond. No? Sudden loss of responsiveness. And you need to be able to do first aid. Okay? So ano yung una-una nating gagawin pag nangyari ito?
Doc, itong ang sign kasi ng nakikita ko dito, itong vague abdominal discomfort. And you have noticed the urine output has increased significantly over the past 24 hours. And also the breathing is deep and rapid. So yun, dyan mo mapapansin. So this is really an emergency case for a diabetic. And alam niyo yung vomiting and nausea. Isa pa yan na magdadagdag ng for that case.
Ito kasi, no, yung blood sugar niya tumaas na over 250.
Yes, random blood sugar.
Kaya diabetic ketoacidosis. And medyo kailangan na talaga lang insulin. Yun nga, kasi you need insulin to let the cells make use of the sugar, which is not happening here. So walang energy na kukuha So ngayon, ang katawan will have to, break down the fat. Okay, my question is, bakit hindi acute renal failure ang naging sagot? What happens ba pag nagkaroon ng acute renal failure? Ano doon sa ating history will tell you that there is no acute renal failure happening here?
Okay, because of this, the urine output has increased significantly.
With acute renal failure, nagre-renal
Konti lang.
down, walang lumalabas. Kaya you also have to know yung urine output niya. O, di ba exciting? What about insulin overdose? Kaya napaka-challenging nito. Ang dami kayang diabetic na pasyente, no? Kaya dapat dito natin magagamit yung ating yung ating skills on puncture. So we have to keep on monitoring. So what happens if there is insulin overdose? Di ba yung iba, puro lang inject ng inject. Kaya dapat kinukunan din ng random na blood.
Kung magkaroon ng insulin overdose din daw, definitely magkaroon siya ng tinatawag natin na the drop yung sugar.
Okay.
So, hypoglycemia.
Okay, very good. So this is DKA ha. Ang kasi dito may amoy na, parang parang bulok na mansanas. Fresh, rotten fruity odor.
Rotten fruit.
Okay. So I hope we know what to do here ha. Sa totoo lang, the ear is so effective. You have to really learn how to, and of course, you need to needle the spleen or the pancreas point. Number 7, Dr. Sam.
Okay, number 7. So, a 40-year-old female complains of excessive vaginal discharge. So, a thin and transparent white liquid is profuse and continuous. She also reports frequent and copious urinary output, loose stools, and cold feeling in the abdomen. Her tongue is pale with a thin white coating and her pulse is submerged.
Okay.
So what is her diagnosis? So this is leukorrhea, diba, Doc?
Yes.
Vaginal discharge. Okay.
Yeah.
This is leukorrhea due to the cold in the lower burner. Hindi, kasi ang tongue is pale with a thin white coating. So walang dampness dito.
Okay.
So on her pulse is submerged. So leukorrhea due to deficiency of the kidney.
So we're going to remove A and D.
Yes, Doc.
Walang dampness.
Walang dampness po. So leukorrhea due to deficiency of the spleen. Tingnan ko muna letter D. Leukorrhea due to damp heat in the lower burner. So definitely this is not damp heat because his pulse is submerged. And also we have a pale tongue with a thin white coating.
Okay.
So this is gonna be a leukorrhea due to deficiency of the spleen. That is letter C.
That's your answer?
Hold on, Doc. Nalito ako.
Leukorrhea
due to deficiency of the kidney.
Okay, wait lang. Yeah.
I think it's kidney. Yeah.
Yeah. Kasi when you have kidney deficiency, you can also have spleen deficiency, right? Spleen yang deficiency. Okay. Copious urinary output. So this is definitely very kidney.
Kidney.
Stools. This is due to kidney yang deficiency and spleen yang. So dito nyo makikita na hindi po pwedeng mag-isa lang. Kidney and spleen yang deficiency and cold feeling in the abdomen. And the pulse is submerged, no?
Submerged, yes.
Yes. Okay, very good. So the answer is leukorrhea due to deficiency
The
of
deficiency of the kidney.
number 8.
Okay. A 40-year-old female has had a low-grade fever for 3 months. So it usually occurs in the morning or is induced by exertion. Other symptoms include emaciation, shortness of breath, general weakness, and lack of spirit, dryness in the mouth without desire to drink, sweating, and sweating on exertion, poor appetite, 2 to 3 daily soft bowel movements. Her body temperature is 99.5 to 140 Fahrenheit. And she has a pale face and tongue. What is the pathogenesis? All right, now if we check on the tongue, uh, hold on. Saan pa yun? The tongue is a pale face and the tongue also is pale.
Okay.
Yeah. And then meron siyang...
What will clinch your diagnosis here? What is your answer ba?
Well, saglit lang, Doka. It usually occurs in the morning or is induced by...
This is low-grade fever in the morning. Okay.
Yes, low-grade fever.
Do you have low-grade fever in the morning if you have a yin deficiency?
Yin deficiency.
Do you have low-grade fever in the morning?
Yes. Yung yin deficient ka, magkakaroon ka ng low-grade fever. So because
in the morning?
Yeah, teka Doc. Morning is yin.
Think ka muna. In morning is not yin. Morning is
yang. Sorry.
So, pag pinapawisan ka in the morning, you probably have yang deficiency or qi deficiency. Or yang deficiency. So this is what clinches your diagnosis. Dito pa lang low-grade fever for 3 months. Usually occurs in the morning. So definitely you're not going to answer kidney yin deficiency with heat. Right? And another thing, if we're going to, okay, you cannot say damp heat in the middle burner because you don't have any, like, ano bang hanapin mo na sintomas para malaman natin na damp heat siya in the middle burner?
Kasi kung may damp heat ka sa middle burner, hold on. Kasi meron din siyang dryness in the mouth. Okay. So dryness in the mouth, actually that's stomach fire. Dryness in the mouth, that is heat.
Okay.
And then, but makikita mo dito rin sa poor appetite and 2 to 3 daily soft bowel. So, kung may damp heat ka sa middle burner, hindi mangyayari na magkaroon ka ng soft bowel movements.
Also, we take this out. Wala na letter A.
Wala na yung letter A.
Letter B. So we're left between C and D.
And that cannot be blood stagnation because the color of the tongue is pale and the face also is pale. So that's definitely the answer is letter C, spleen Qi deficiency.
Okay, very good. Okay, let's Ma'am Ami, you're going to handle 11 to 15. Okay, 11 to 15 po, Ma'am Ami. Okay, let's continue. Dr. Sam, sa number 9.
A 67-year-old female patient's hearing has declined rather suddenly, and she has constant ringing in her ears that cannot be alleviated by pressing her hand over her ears. She has a bad temper and often has headaches. Her face is flushed and her pulse is forceful and wiry. So what is the pathogenesis? So forceful and wiry, wiry, that's very liver. Okay. So as you can see, her face is flushed and her pulse is, so that's gonna be, hold on. I think it's liver fire flaring up.
Very good.
Because yeah, you can see also that may ringing sa kanyang ears, and then napakaano niya, Doc, parang irritable siya dito.
Pulang-pula yung mukha, forceful, very excess.
Laging sumasakit ang
Very
ulo.
excess.
Very excess yan.
So hindi po pwedeng si letter A, deficiency to eh.
Hindi mangyayari yan, Doc.
Okay, what do you think would be would happen when you have liver blood deficiency wind?
Well, liver blood deficiency wind, so magkakaroon ka ng pagkahilo, dizziness.
What about tremors?
Yeah, because that is wind. So mayroong mga tremor, panginginig. Nakalimutan ko yung ibang ano, Doc. Sa liver blood deficiency.
Correct answer. Okay, what about the tinnitus? Anong pagkakaiba ng tinnitus sa kidney deficiency?
Sa kidney deficiency, compared to liver,
low pitched or high pitched?
Sa kidney deficiency is low pitch. The high pitch is liver.
Okay, very good, Dr. Sam. Let's go to the last question for you. Number 10.
A 34-year-old female patient suffers from chronic fatigue pattern for 3 years. So matagal na to. Her tongue is slightly pale and with teeth marks, and there is a thin white coating. Her pulse is deficient. TCM diagnosis is Qi deficiency. Which of the following symptoms might she also have? Qi deficiency, so that is deficiency of the spleen. Kasi meron pong teeth marks. So there is a thin white coating. So regular menstruation, hindi. Kasi deficient dapat yung blood sa liver. And then thirst, merong fire. So spontaneous sweating, deficient white coating, Qi deficiency. The answer is letter C, spontaneous sweating. So hindi siya magdi-disturb din ng sleep nito, Doc.
What do you mean by spontaneous sweating?
Yung bang ano, Doc, pagpapawis mo na
kahit hindi mainit.
Kahit hindi mainit, tapos konting galaw mo, pinapawisan ka.
What causes that? Like, bakit yung ganon? Di ba nagpapawis, we're talking about skin pores, right? So, what particular pattern are we talking about na, which is governing the closing and the opening of the pores?
Yes. Well, if we have a spleen Qi deficiency, that will affect the lungs. Yeah, because the transport and the transform of the spleen is also magkakaroon din po ng problema. That's why it would affect the lungs in producing what we call the defensive Qi or nutritive Qi. Yeah. And the lungs actually controls the opening and closing of our pores.
Galing. Talagang, ewan ko lang, parang gustong pumutok ng puso ko dahil sa galing ninyo. Yeah, so lung Qi actually governs the Wei Qi, and the Wei Qi is the one that, basta pag Wei Qi, may kinalaman ng lungs dyan. The lungs are supposed to control the opening and closing of the pores. Okay?
Yes.
So pag parati lang siyang bukas, hindi siya nagsasara. So mahina po yung ating lung Qi. Congratulations, Dr. Sam. Good job. Excellent job. Thank you. Now,
thank you,
let's go to Ma'am Ami, 11 to 15.
Unmute ko lang. Good evening po,
Pakilakas
Doc.
ang mic mo, Ma'am Ami.
Hi, Doc. Ano ka na? Yan na po. Number
Okay.
11, a 43 years old woman complained of low-grade fever that persists throughout the day. She also experiences a heavy sensation in her head, limbs, and trunk, and a stifling sensation in her chest, especially bothers her. Her appetite is poor, associated with abdominal distension and lethargy after meals. Her pulse is saggy and slippery, and her tongue has sticky slight yellow coating. What is the diagnosis? Letter A, kidney deficiency. B, damp heat in the upper burner. C, deficiency, Qi deficiency with numbness. And D, spleen Qi deficiency. Doc, bali, the answer is damp heat in the upper burner. Dahil meron po siyang stiffy sensation in her chest, especially. Wala po siyang ganang kumain with abdominal distension. And kanya pong pulse is saggy and slippery. Sticky light yellow coating. Bali, hindi po kidney deficiency dahil ang disharmony po nito is and meron po siyang pag kidney deficiency po, may mga nagmamanifest po ng dizziness, soreness and weakness of the lumbar region, and knees, seminal emission. And meron din naman po siyang low-grade fever pag kidney deficiency.
Pwede niyong sabihin sa amin yung tongue picture ng isang may kidney yin deficiency.
Ang may kidney yin deficiency po is yung pong kidney.
May coating ba?
Ang kidney. May coating po, Doc.
Kidney yin deficiency.
Yes, Doc.
Ano ba ibig sabihin pag yin deficiency? May coating o wala?
Ang yin deficiency po is no coating. Sorry, Doc.
Okay. What about, so ang patient natin, meron siyang coating, yellow coating. So bakit
Yes, Doc.
po hindi, di ba meron ding dampness itong letter C? Bakit hindi po yun ang sinagot natin?
Letter C. With dampness.
Pag nakita ba natin yellow, may kinalaman ba yung kulay ng coating?
Bali, Doc, kasi sa spleen Qi deficiency with dampness, Doc, ang may tik-tik po yung ano niya, yung tongue. Dahil po merong may yellow coating.
So may yellow coating pag may
Swollen din po pagka spleen Qi deficiency. Swollen po yung tongue. And may teeth mark.
Okay, meron bang anong kulay po ng coating pag may spleen Qi deficiency with dampness?
Wala pong coating.
Walang coating?
Moderate lang po, Doc.
Ang tanong ko, anong color?
With dampness po, yellow coating. Pero slight lang po.
Okay. So saan ba dito? Bakit po ang sagot niyo letter B, hindi letter C? Magkapareho po ba ito? Anong pagkakaiba?
Bali daw kasi yung damp heat, dahil nga po yung tank niya is sticky, slightly yellow coating.
Okay.
Pero dahil sa...
Meron po ba tayong low-grade fever pag may spleen Qi deficiency?
Meron po. Meron din po. Meron din po. Yellow. Pero meron din po siyang... pale yellow complexion.
No. Ang tanong ko, mayroon po bang low-grade fever pag meron tayong spleen Qi deficiency?
Wala po pala, Dok.
Okay.
Wala po, Dok.
ano ba yung, okay, so hindi natin pwedeng sagutin si C and D. So ang naiwan, letter B.
Letter B po.
Okay. Ano pong itsura ng tongue ulit pag may kidney deficiency? Anong kulay ng coating?
No coating. No coating, Dok.
No coating.
Kasi yung deficiency po.
Okay. Anong pagkakaiba po ng empty heat sa kidney deficiency with regards to color of the tongue body? Di ba meron tayong diagnosis na kidney yin deficiency? Meron din tayong kidney yin deficiency with empty heat. Ano po ang magiging kulay?
Red po pagka empty heat.
Okay.
Red.
Kidney yin deficiency.
Fail po ang color.
Okay. Pero in actual practice, most of the time, magiging red na po, no? Lalo na pag chronic na. Usually pag ano, no? Okay. Kasi mga tao saka pa lang nag-aano pag medyo malala na.
Okay.
Let's go to number 12, Ma'am Ami.
A female patient has history of acute nephritis and duodenal ulcer for 5 years. She has no kidney or ulcer symptoms, but she does have weakness in the limbs, a pale and yellowish complexion, abdominal bloating, poor appetite, shortness of breath, loose stools, and sweating after slight physical exertion. What is the pathogenesis? A. Kidney essence insufficiency. B. Kidney Qi deficiency. C. Spleen Qi deficiency. And letter D. Spleen Yang deficiency. The answer, Doc, is spleen Qi deficiency. Spleen Qi.
Bakit hindi spleen Yang deficiency ang sagot nyo?
Bali po wala po siyang manifestation ng heat. So pale and yellow complexion po siya.
So ibig sabihin pag spleen Yang deficiency may heat?
Spleen Yang deficiency, yes, Doc, may heat po siya.
Would you like to
sorry, Doc. Spleen Yang deficiency is kulang siya sa cold. Kulang siya sa
cold?
Yes, Doc.
May heat siya.
Kulang siya sa deficient siya Doc sa heat.
Okay. So ano?
Yang.
So pag deficient sa heat, sa yang, anong nararamdaman ng patient?
Bali po spleen Yang, Doc.
Or anong pagkakaiba ng spleen Qi deficiency sa spleen Yang deficiency?
Yun nga po, Doc, yung spleen Qi deficiency, may pale and yellow complexion siya, may abdominal, while yung spleen Yang po, ano po siya, pale po yung tongue niya.
Sa spleen
Pale, pagka spleen Yang deficiency is pale po yung tongue and then swollen and wet.
Swollen and? Swollen and?
Po. Tapos yung kanya
bakit
pulse
red?
is deep.
So, ang spleen Yang deficiency, magiging red po yung kulay ng tongue?
Yes po. Hindi po. Pale po. Yang po eh. Deficient po sa
Alin
sa
po
heat.
ang nauna? Spleen Qi deficiency or spleen Yang deficiency?
Spleen Qi po.
Okay. Anong pagkakaiba? Ano yung hahanapin natin para masabi natin na spleen yang deficiency yung problem, hindi spleen Qi deficiency. Kasi sagot nyo dito, spleen Qi deficiency. So ano yung dapat meron sa history ng patient para yung sagot natin, spleen yang deficiency? Kasi sinabi nyo, ang spleen yang deficiency is an advanced stage of spleen Qi deficiency. Spleen Qi deficiency muna bago magkaroon ng spleen yang deficiency. So my question is, ano yung hahanapin natin?
Sa pulse, with regard to pulse po ba, Doc?
Yeah.
Bali po yung spleen yang
Kahit
spleen yang po.
symptoms.
Yung pulse po is deep dahil meron po siyang forceless, cold
Okay,
siya.
ganito na lang. Meron kang isang pasyente, yung dalawa pala. Yung isa may spleen Qi deficiency, yung isa may spleen yang deficiency. Anong pagkakaiba?
Parehas po kasi sila, Doc, na ano for appetite sila. Tapos, may
Pag
abdominal
gusto
din
mong
sila.
tumingin-tingin man sa group chat, lifesaver. Madali kayong ma-stress, madam, no? Nakakatakot ba yung mukha ko?
Ay, hindi po, Doc. Hindi.
Okay, good.
Hindi po.
Ano nabasa niyo sa group chat, courtesy of Ma'am Lynn? Ma'am Lynn, you take care of 16 to 20, Lynn Galarita. So, Ma'am Ami, ano pong nakikita sa group chat? Ay, wala kayo nabasa. Nakikita niyo ba yung group chat?
Yes po.
Anong sabi ni Ma'am Lynn dyan? Pag may
Ayun na nga po, Doc. Sinabi ko na po kasi kanina, yung spleen niya is meron siyang cold.
Ang tanong ko kasi, meron kang dalawang pasyente. 'Di ba? Yung isa may spleen Qi deficiency, yung isa may spleen yang. Ang tanong ko, ano nga pagkakaiba? Yung isa, malamig yung paa, may feeling of cold, 'di ba? Actually, paikot-ikot lang tayo. Kung napansin niyo mga questions natin, paulit-ulit, no? So, yun. Let's go to number 13.
A 30-year-old man has been suffering from headaches for the past 5 years. The headaches occur over the whole head and or are dull but intense in character. They improve when lying down and worsen with stress or exposure to the light. The headaches are accompanied by nausea, vomiting, and a feeling of cold. He has a hypochondriac pain and prone to constipation. The tongue is light, dusky, and swollen with dirty coating. What is the correct diagnosis for this patient? Letter A, liver yang rising due to liver yang deficiency. Letter B, liver yang rising due to liver blood deficiency. Letter C, liver yang rising due to liver and kidney yang deficiency. And letter D is liver fire.
So what is our answer?
The correct answer, Doc, is liver yang rising due to liver blood deficiency. Liver blood deficiency. Dahil, Doc, meron po siyang with dirty coating. Ang tongue niya is slight dusky and swollen. Tapos,
so, if yung answer natin is letter C, liver yang rising due to liver and kidney deficiency, what do we expect to see on the tongue? Are you going to see a coating?
Without coating, ang liver yang due to liver and kidney.
Okay.
Without coating.
Anong pagkakaiba ng liver yang rising sa liver fire? Pag liver fire yung diagnosis, ano yung hahanapin natin?
Yung unang-una, Doc, sa mata, na meron siyang, yun nga, medyo namumula po yung mata niya. Tapos,
Yung
meron
panlasa,
irritable
ano
siya.
yung magiging panlasa niya?
Yung panlasa niya po is bitter.
Yung mukha niya?
Yung meron po siyang
Pag liver fire.
mainit po.
Mainit o yung kulay ng mukha niya pag liver fire?
Mapula po ang kanyang face. Tapos sa liver yang due to liver and kidney yun naman, Doc. And liver
Okay.
yang rising
So yung sagot natin, liver yang rising due to liver blood deficiency.
blood.
Bakit
Yes.
po nag-i-improve yung symptom pag nakahiga siya? Or pa nagpapahinga yung pasyente?
Dahil po, Doc, na di ba po kapag ang liver po, siya pa yung doon naka-store ang ating blood.
Okay.
So,
Pag nakahiga tayo, natutulog, may time siya mag-store ng blood. Kaya nawawala yung headache.
Yes.
Oo. Kasi yung headache niya dito, nagkaroon po ng liver yang rising dahil kulang yung liver blood.
Opo.
No?
Not enough blood, supply of blood.
Okay. If your answer is letter A, what are the accompanying symptoms aside from the ones like ano yung mga clinical manifestations?
Ang unang ang liver yang rising due to liver yang deficiency is no coating, Doc.
Anong manifestation ng patient?
Tapos yung pong kanyang slightly red po yung kanyang side of the tongue. Yung kanyang side of tongue po, medyo red po.
Puro red yan sila, di ba? Liver yang rising yan. Ang symptoms po, pag may liver yang deficiency, di ba meron din siyang tinnitus?
Apo, may tinnitus din po.
At the same time, merong 5-pound heat. Nakikita ba natin ito sa pasyente?
May tinnitus, yun nga po, meron din siyang, yun lang po, Doc.
Okay.
Ang pulse niya po is wiring. Pag liver yang rising.
Yes, very good. Pero hindi nila mention dito yung pulse, di ba? Kasi it will give away.
Wala pong mention.
Okay. Number 14.
A 21 years old male suffered from palpitation with anxiety for 2 years. He has palpitation 5 to 8 times a day. He also complains of poor memory, dizziness when studying hard, insomnia with dream disturbed sleep. He has pale face and pale tongue with thin white coating and frail pulse. What is the diagnosis? A. Heart Qi deficiency. B. Heart blood deficiency. C. Fire disturbing the heart spirit. D. Phlegm obstructing the orifices. The answer, Doc, is letter B. Heart blood deficiency. Dahil po meron siyang palpitation for 5 to 8 times a day. So, madalas po. Tapos, ano pa po? May insomnia po siya. Dream disturb po. Dahil parang wala pong shen, kumbaga.
Okay. Dahil saan? Hindi naman walang shen. Hindi, restless lang yung shen. Wala siyang residence.
Wala nang residence. Yes, Doc. Tapos, ano po siya? Heart blood deficient siya. Medyo tinatamad po siya. Yung spirit niya, lack of strength. And then, spontaneous, meron din po pag may heart blood deficiency, meron din po siyang spontaneous sweating. Dahil nagkaroon siya ng insomnia. Ang kanya pong lips and nail at ang buhok ay nagmamanifest din po pagka sa heart blood deficiency po.
Okay. So this is very common actually. No?
Yes.
So poor memory, importante
Yes,
yan.
for memory.
Dizziness, insomnia with dream disturbed sleep. Because restless po yung Shen.
Yes po.
Okay, let's go to the last number for you.
Ralph is a timid person who gets palpitations when he's surprised. He is easily frightened, especially by the strange noises. He suffers from restlessness, dream disturbed sleep, irritability, anorexia. His tongue coating is thin and white. What is the most appropriate diagnosis for this patient? A. Gallbladder Qi deficiency. B. Hyperactivity of heart due to yin deficiency. Letter C. Heart and spleen Qi deficiency. And letter D is liver Qi stagnation. The answer, Doc, is letter A. Gallbladder Qi deficiency.
Okay, this is actually very common. Huh? Gallbladder Qi deficiency. Also, madali silang magising maaga. Super aga sila nagigising. Minsan 1 a.m. or even 12 midnight. Then they cannot sleep again. So yan. Easily frightened, may dream disturbed sleep, irritability, anorexia. So yun. Timid. Hindi siya risk taker. Marami pong ganyan. So you have to do something about the gallbladder Qi. Okay? Okay, maraming salamat po, Ma'am Ami. Good
Thank you,
job.
Doc. Thank you po.
Let's go to Ma'am Lynn from 16 to 20. Good evening, Ma'am Lynn.
Good evening po.
Good evening.
Naririnig po, Doc?
Opo.
Hello?
Yes.
Okay,
You're
sige.
coming in clear.
Numbers. Okay po. Okay po.
Pakita
Number
mo yung mukha mo,
16.
madam.
Which of the following prescription? Okay po.
Sa cough na tayo ha, ubo. This is very, very common. Okay.
Which of the following prescription?
Ay, nawawala yung signal nyo pag nagpapakita ng video. Madam, Ma'am Lynn,
Which of
tanggalin.
the following prescriptions of the invasion by Ay po.
Okay.
Ayan.
Yan.
Medyo mahina po ang signal po.
Oo,
Okay.
nawawala pag nagbe-video. Okay, sige na lang po.
Which of the following
Okay.
Which of the following prescriptions is most commonly used to treat in liver 1, liver 7, lung 1, lung 7, and kidney 6. Letter B, lung 7, LI 4, and bladder 13. Letter C, do 14, Sanjiao 5, gallbladder 20.
Okay.
Letter D, lung LI 4, lung B, bladder 13, lung 5, stomach 36, and stomach 40. Ang choice ko dito, Doc, yung mga points na nagre-release ng exterior kasi exogenous pathogens eh. So I would choose lung 7, lung LI4, and bladder 13 kasi ito yung backshoe ng lung. So letter B.
So what we're trying to do here, we try to strengthen the defenses, di ba? Kaya napaka-effective if you focus on the backshoe, which is bladder 13. What is the classification of lung 7?
Okay po.
Why would we use lung 7?
Lung 7 is lung 7 is the loop connecting point of the lung meridian. It's
And
also the confluent point of the conception vessel.
it is, yeah, command point din siya ng head and neck. Command point. And remember, saan po ba pumapasok yung ano, 'di ba, sa may
po,
neck
command
area?
point of it.
So
And
so the correct answer, lung 7, LI4, bladder 13. Very basic.
and 13. Okay po.
Okay, thank you. Let's go
Number
to 17.
17. Number 7. Okay po. Number 17. Apart from bladder 13, lung 1, and lung 7, which of the following points would you consider the main point to treat a cough due to deficiency of lung yin? Letter A, lung 5. Letter B, lung 9. Letter C, lung 10. Kidney 6. And letter E, kidney 6. Because kidney 6 is the confluent point of the yin motility vessel. It nourishes the kidney, it clears deficiency heat, it calms the spirit, and regulates the lower jaw.
Okay, so what is the answer?
Naririnig ko ako, Doc?
Opo. Letter
D po, letter D. D. For yin deficiency.
Okay, you were saying
Lung deficiency.
confluent point
Kasi
po.
pag yung kidney, confluent point of the yin motility vessel.
Yeah, are we talking about the yin chow?
Yes po.
Okay. Kasi ano, ang lung 7 and kidney 6 are supposed to be the confluent points of the yin. Yeah, is that the ano, yin chow ba?
Opo.
Yeah, are we sure? Yin chow. Okay, so since mayroon ka ng lung 7, bakit hindi po kidney 3 ang ginamit natin? Kidney 3, I believe, is also a very good Pero ang problema lang kasi, I
kidney
think
3 kasi mas ano po siya for kidney yin.
Yeah, kidney
Mas
yin
for
din.
tonification.
Oo, pero more on, yeah, kasi nandiyan na si lung 7.
Kasi lang yin ang naka-specified.
Okay. Yin deficiency. So ito yung patient where you will have to expect.
So more kidney, yung kidney 6.
So the answer is kidney 6.
Napuputol kayo, Doc.
Oo, yung signal nyo yata mahina. Oo. Asan po ba kayo ngayon? Batangas? Sa Marikina?
Oo po, medyo may. Nasa QC po, nasa QC. Medyo umuulan po kasi kanina.
Okay.
Pangit ang panahon ngayon dito.
Okay, sige po. The correct answer is kidney 6. Let's go to number 18.
Letter D. Okay po. Number 18. Lung 11 can be selected as a supplementary point to treat a cough accompanied by A, fever, B, aversion to cold, C, pain and swelling of the throat, letter D, headache, letter E, dryness of the nose. Lung 11 po, Jingwell point po siya, so it clears heat and benefits the throat. So, ang answer ko po ay letter C, pain and swelling of the throat.
Okay, Jingwell.
Like kung merong tonsillitis.
Yeah.
Yes po.
Yeah.
Okay.
Maganda siya basta below the heart. Maganda din siya to treat fullness below the heart and clear the heat. Okay, correct answer is pain and swelling of the throat. Let's go. Okay.
Okay po.
Before we continue, Ma'am Evelyn, you'll be next po. Ma'am Evelyn Cruz, 21 to 25. Sige po. Let's continue with number 19, Ma'am Lynn.
Okay. Number 19, which of the following points would you select to treat a patient with a cough who is spitting blood or even coughing blood? Letter A, do 14 and Sanjiao 5. Letter B, lung 6 and bladder 17. Letter C, lung 11 and LI 1. Letter E, spleen 6 and lung 1. So definitely pipiliin ko po yung merong bladder 17 kasi yung influential point of the blood.
Okay. Yun,
so kung merong coughing of blood or spitting of blood, so dapat meron siyang bladder 17.
Okay, so yung partner niya is si lung 6.
Tapos yung lung 6, yung lung 6 po indicated din po siya for excessive heat with bleeding and coughing of blood. It's the Shickliffe point po. So
yeah, very good.
Ang answer ko po talaga, letter B, lung 6 and bladder 17.
So for patients who have, they call this hemoptysis, hemoptysis, para in sync na tayo with medical people. Hemoptysis, no? So spitting blood or, coughing blood. Okay, so we have to combine bladder 17, which is the influential point ng blood.
Okay.
Also lung 6, which is the Shickliffe point of the lung. Okay, so this is a yin Shickliffe, so it's very good for bleeding issues. Okay, blood issues rather. Let's go to number 20, Ma'am Lee.
Number 20. Which of the following points are used to treat a cough utilizing cupping? Letter A, bladder 12 and bladder 13. Letter B, lung 5 and LI 11. Letter C, do 14 and do 13. Letter D, LI 4 and lung 11. Letter E, stomach 36 and spleen 6. So kung cupping, I would choose back shoe points, Doc. So, so I would choose kung related din sa cuff, the acupoints na related din po sa lungs.
Okay.
So definitely merong bladder 13, tsaka bladder 12.
Okay, very good. Good job. Yeah, letter A. Bladder 12 and bladder 13. Okay? Napaka-effective po ito if you want to use cupping for treating cough. Maraming salamat po, Ma'am Lynn. Excellent job.
Okay.
Very easy, no? Okay. Let's now go to Ma'am Evelyn Cruz, 21 to 25. Ma'am Evelyn Cruz.
Yes po, good evening, Doc. Yes, medyo brown out po kami, Doc. Nakakandila lang.
Sorry po. Bakit brown out? Saan po ba kayo?
Batangas po, ang lakas po ng ulan na marami po daw tinamaan na kidlat na poste.
Ay,
Kaya
naku,
ay na pa po umaga.
Malakas pala ulan dyan. Grabe, no?
Yes po, opo. Lobat na po kami.
Tuloy
Kaya
pa rin
po
tayo kaya pala hindi makapasok siguro yung iba. Baka nabasa sa ulan.
Wala akong signal, Doc. Naka-data lang din po.
Ay, I appreciate your effort. Sige lang, tuloy lang po tayo. Maraming salamat, Ma'am Evelyn.
Thank you din po. Number 21, which of the following channels would you see first to treat cough by tapping method with a cutaneous needle? A, rin and do channels. B, lung and spleen channels. C, do and bladder channels. D, kidney and rin channels. E, none of the above. My answer, Doc, is letter C, dew and bladder channels po.
Okay. Tapping lang yan ha, tapping. Siguro when you attend the practicum, si Dr. Webb will show you how it's being done using a cutaneous needle. So it's very sub-Q. Okay, so dew and bladder channels. Very easy. Let's go now to number 22.
Yes. The prescription of bladder 13, lung 5, and stomach 40 can be used to treat cough used by A, invasion of cold, B, invasion of heat, C, dryness of the lung with a deficiency of yin, D, blockage of the lung by phlegm, E, weakness of the lung and kidney. My answer, Doc, is blockage of the lung by phlegm.
Okay, napakadali. Ano po yung ano ninyo dito? Ano yung guide nyo para like sa mga points pa lang malalaman mo na eh, no? Syempre, meron po kayong ano dito, nakita sa points that will lead you to say that this is very good for treating cough caused by blockage of the lung by phlegm. So amongst the 3 points, alin po dyan yung very good for the phlegm?
Yung bladder 13 po, o tsaka stomach 40.
Number
Kasi
1 is stomach 40.
Yes po.
Huwag niyo po talaga kalimutan yan.
Yeah.
Okay.
Sa phlegm
Stomach 40, first and foremost. Yung lung 5, it is very good for the cough, for excess. Yung bang ubo ng ubo, tapos parang panay-panay na, no? And bladder 13, we know, is the back shoe. So hopefully, marunong na tayo mag-treat ng cough. Let's go to number 23, but before we do that, Ma'am Lane Arandia, you'll be next, 26 to 30 po. No? Okay, let's continue. Ma'am, baka maubos na yung kandila nyo. Joke.
Maubos na, malulubat na po
Ingat po
kasi.
kayo sa kandila. Ay, malulubat na. Okay.
Yes po.
Okay. Bilisan na
Okay.
natin.
Kaya na pa umagang brown outlook eh.
Ay,
Number
grabe.
20.
Bakit?
Yes po,
Because of the rain?
Kidlat at kulog, Doc, marami po daw tinamaan na mga poste. So baka daw hanggang bukas po kami brown out.
Paano yung ano nyo? Ano ko, maglulubat kayo? O sige, bilisan na natin. Principal point for the treatment of asthma.
Yes. Which of the following points is the principal point of the treatment of asthma? A, REN 22, B, stomach 40, C, bladder 13, and stomach 3, letter D, and letter E is lung 9. So the answer is letter C po, yung bladder 13. Yan, na-explain na po kanina.
Okay, very easy. Sige
yes.
po, number 24.
24. A patient has following signs of symptoms: short and rapid breathing, strong and hoarse voice, cough and thick yellow sputum, fever, restlessness, toughness of the chest, a thick yellow coating on the tongue, and rolling and rapid pulse. The best prescription of points at this stage is the disease is, my answer is letter B, bladder 13, lung 5, and stomach 40. Yan, yung parang po sa cough, phlegm, stomach 40, yeah, stomach 40 and bladder 13, partner lagi po yan.
Yeah, slippery, rolling. Rolling is also slippery, ha?
Okay po, Doc.
Saka rapid, so may heat.
Rapid, yeah.
So we use lung 5 for heat. Okay, this is very common. And you try to locate Ding Chuan, no? Ding Chuan. I don't know if I pronounce it right. Okay, Ding Chuan. Extra point. It's so effective. So short and rapid breathing, strong and coarse voice, coughing, thick yellow sputum, phlegmas. Okay, let's go to the last one, Ma'am Evelyn.
Yes po. Using moxibustion, which of the following points have proved effective in the treatment of persistent asthma? My answer is letter D, Do12 and bladder 43.
What's so special about bladder 43? Bakit siya
Bladder 43.
napakaganda for persistent asthma? How do you classify it? Because ang bladder 43 po, tinotonify niya po yung Qi ng buong katawan. Remember, persistent na yung asthma niya. So most likely, baka nangayayat na siya dahil sa asthma niya. No? And it's very good for strengthening weak and deficient people. Ang system po dito is you have to do moxa. No? Okay. Kasi persistent na yung asthma eh. Okay? So locate bladder 43. And why do you think are we going to use Do12? What is so special about Do12? Madam, baka maubos yung battery nyo. Sige. Do12 is, what is the classification? Ang maganda po sa Do12 is, it's very good for asthma again. It clears lung heat, no? At saka it also strengthens the body. So itong Do12 and bladder 43 is very good for people na medyo nangayayat na or nanghina na dahil yung asthma niya persistent. So I hope you all remember this and good luck po dyan. Baka maubos na yung siguro pati power bank nyo na drain na, madam.
Wala po kami power bank, Doc.
Okay, sige. Maraming salamat po, Ma'am Evelyn.
Thank you po, Doc. Thank you, Doc. Thank you po.
Let's go now to Ma'am Lynn Arandia. 26 to 30, Ma'am Lynn.
Number 26, each of the following points may be selected to treat asthma due to the deficiency of the kidney, except on A, bladder 13, B, bladder 23, C, kidney 3, D, ren 6, lung, and E, lung 5. Ang treat asthma, ito pong letter E, lung 5. Kasi po ano siya, nagpapa-clear clear the lung heat. Hindi siya good for kidney deficiency.
What about ren 6?
Ang ren 6 naman, nagpapa-strength ng kidney Qi. Kaya ano po siya, kasama po siya doon sa pag-treat ng kidney deficiency po. Nagre-regulate ng Qi, benefit original Qi. Kaya ang sagot po letter E.
So lung 5 is hindi
Clear
kasama
lang.
for
Opo.
excess. Okay. So bladder 13 is good for kasi magkasama yung lung pati kidney, di ba?
Regulate lung Qi po siya. Stops cough.
Okay, very good. Let's go to number 27.
Number 27, all the following points can treat asthma due to wind cold, except A, bladder 13, letter B, bladder 12, letter C, do 14, lung 9, and E, LI4. Ang except po is itong letter D, lung 9. Then nag-tonifies and regulate lung Qi. Tapos expel wind.
So wala siyang okay, bladder 13 is the box shoe, bladder 12, do 14. Do 14, pag pinalakas mo do 14, mawawala si wind cold, di ba? LI4, alam natin. Okay. Lung 9, ano po ba yung property ng lung 9?
Nagtotonify siya nagtonifies and regulate lung Qi, expel wind.
Classification.
Lung 9 po, ano siya, shoestream ng lungs.
So, okay. Hindi siya pwedeng mag-eliminate ng wind. Okay. Let's go to number 28.
Number 28, a young patient has the following signs and symptoms: distending pain in the epigastrium, which is aggravated on pressure after meals, belching with fetid odor, anorexia, a thick sticky tongue coating, and a deep forceful pulse. The best prescription at this time is ang choice ko po itong letter B, yung REN 11, PC6, stomach 36, innernating. Dahil po yung REN 11, nag-harmonize siya ng spleen and stomach, descent stomach Qi. Kasi nga po mayroon siyang distending, belching, anorexia.
Sticky-tongue coating, deep forceful pulse. So bakit hindi pwedeng gamitin si letter E?
Letter E.
Okay, definitely ang problem talaga niya is stomach talaga, di ba? Distending pain in the epigastrium, which is aggravated on pressure. So hindi natin pwedeng sagutin si liver letter E kasi nga hindi naman dahil sa liver Qi stagnation yung cause, di ba?
Yes, po, wala pong related sa mga liver indication.
And letter D, wala ring related, hindi din siya related sa ano.
Okay.
Correct answer is letter B. Pericardium 6 can actually move the Qi, no? Kaya nga yan yung ginagamit pag nasusuka, no? Pericardium 6, and of course we know the importance of stomach 36. Okay, let's go to number 29, Ma'am Lynn.
Number 29, the prescription of liver 14, REN 12, PC6, stomach 36, and liver 3 is used to treat epigastric pain caused by A, retention of food, B, deficiency of the stomach and spleen, C, accumulation of cold, D, attack of the stomach by liver Qi, E, deficiency of spleen yang. My answer is letter D, attack of the stomach by liver Qi.
So ano po dito ang alin point po para makapagsabi na dahil po ito sa attack ng liver Qi sa stomach? Ito, di ba? Si liver 3 and liver 14. Liver
3 po. Liver 3 regulates liver Qi.
Oo. Ano po ang classification ni liver 14?
Front view.
Front view ng...
Front view po ng liver.
Okay. So definitely liver 14 and liver 3. Okay. Ito yung nag-give away ng answer. So, very common po ito, lalo na pag nagalit tayo or na-stress, and then sumakit yung ating tiyan. Okay? Kaya, kung kumakain ka, mawawalan ka ng gana kumain. Okay, number 30. Ma'am Jane.
All the following points are principal points for the treatment of vomiting except A, REN 12, B, stomach 36, C, PC6, D, liver 3, E, spleen 4. Except ito pong letter D, yung liver 3.
Okay.
Ano na liver 3 related po siya sa liver, hindi po siya doon sa stomach, sa vomiting.
Spleen 4, anong classification is spleen?
Spleen 4 po.
Yung connecting, di ba? So, ibig sabihin yung action niya is nakafocus kay stomach. 'Di ba? Oo, kasi vomiting eh, stomach na stomach. So you can actually use the luo connecting, which is a spleen 4. 'Di ba? Luo connecting point. Yeah, which is very good for affecting the stomach. Luo connecting point po ito ng spleen. And then siya din yung master point, no, ng Chiang Mai. Okay. Maraming salamat po, Ma'am Lane. Hindi kayo nag-brown out dyan? No?
Hindi naman po.
Okay, so I'm afraid wala na po yung iba. Ewan ko anong nangyari. Let's go back to Ma'am Angel once again. Ma'am Angel, 31 to 35. Maraming salamat po, Ma'am Lane.
31 to 35. 31 to 35. A. Accumulation of damp heat in the kidney and urinary bladder. B. Deficiency cold of the kidney and urinary bladder. C. Deficiency of the spleen and kidney accompanied by fluid retention. 31. Scanty urine is most likely caused by answer ko po is letter C, deficiency of the spleen and kidney accompanied by fluid retention.
Okay. Dito nyo makikita na magkatuwang talaga po si spleen and kidney. No? Diba? Remember, spleen and kidney yang, they're always together. So pag mahina po yung spleen and kidney yang natin, there will be failure of transportation and transformation. So nagkakaroon po ng fluid retention. Yes. So scanty urine. So ang tanong ko, Ma'am, nawala si Ma'am Angel, are you still there?
Yes, Doc. Yes, Doc.
Oo. Ano po ang hahanapin? Kung ito yung sagot natin, deficiency of the spleen and kidney, what do you expect to see in the tongue? Kasi pag sinabi mong fluid retention, yun po, konti lang yung ihi. So, hanapin ko, titingnan ko kung ano ba, kasi yung cause, alam na natin dito sa ating questions, scanty, ano ba tawag dito? Spleen and kidney deficiency. No?
Opo.
So, anong makikita natin? Let's start with the color of the tongue. Ano po kulay ng tongue?
Pale po, Doc.
What about what about the coating of the tongue?
Coating po, Doc, is yellow.
Yellow ka agad?
Ano muna, Doc?
Ano pa lang to
white muna, Doc. White muna, Doc. White muna. Tapos dry.
Ano makikita natin? Makapal ang coating?
Opo, Doc. Medyo
Or
makapal,
walang
Doc.
coating?
Medyo makapal,
by
Doc,
the way, yung
coating.
size ng tongue, would you expect it to be thin? Will it be payat or will it be swollen?
Swollen, Doc.
Okay. What about the pulse?
Pulse is
Scanty urine, fluid retention. Kapag spleen and kidney, pag spleen, ano kaya? Slippery? Shall we expect? Definitely hindi siya wiry, no?
Hindi po, Doc. Kasi liver ang wiry, Doc eh.
Di ba pag sinabi mong fluid retention, parang papunta na rin sa dampness yan, di ba?
Opo.
Okay. Number 32, Ma'am Angel.
32. Frequent urination with clear urine suggests answer. B. Deficiency cold of kidney and urinary bladder po.
Ano po ibig sabihin ng deficiency cold? Is it similar to Empty cold. Empty cold, di ba?
Opo, Doc.
So empty.
Parang empty cold po.
Okay. So, pag empty cold, ano yung makikita natin sa tongue? Do we expect to
Ano, Doc?
see moist coating or a
No,
dry?
no moist. Dry coating po, Doc.
Will the color of the tongue be pale?
Dry
Dry coating?
po, Doc. Dry.
No. Bakit dry? Cold nga.
Ganito ha, isip-isip, empty cold.
Ay, hindi, Doc.
Cold na siya, hindi siya heat.
Oo, damp, Doc, damp.
Bakit ka?
Ano ba nangyayari pag may yang deficiency? Di ba opposite ng yin deficiency? Pag yang deficiency, okay, anong posibleng mangyari?
Kulang po siya sa...
Pag hindi mo na-resolve yun.
Ano po siya, full of yang po siya, Doc. Magiging ano po siya, yin deficiency.
Yin deficiency? Pabalik na tayo ng yin deficiency. Remember, yung pasyente mo, panay-panay na yung pag-ihi, tapos clear ang urine. Clear na yung urine. Madaming ihi. Tsaka nanlalamig siya, di ba? Okay, sige, mamaya na baka mawala na rin tayo. Number 33.
33. Frequent urination, scanty in amount, and deep yellow in color suggests accumulation of damp heat po in the kidney and urinary bladder. Kasi deep yellow po yung urine niya.
So, ibig sabihin,
so damp heat po siya.
Pag may heat, kukunti lang yung ihi.
Opo.
Saka
Kasi
yung
parang
kulay
dehydrated.
niya, dark yellow or deep yellow.
Opo.
Okay. Let's go to 34. Sige, 34 hanggang 37 na po. Basahin mo na lang yung 34, 35,
okay, Doc.
tapos pipili tayo.
Number 34 po. Fixed pain is often due to letter F, Doc, obstruction of channels and collaterals by cold dampness.
So what actually happened here?
Nagkakaroon po siya ng Doc, phlegm.
Stagnation.
So yun po yung nagiging Doc, nagiging yung phlegm. Opo.
So ang cold dampness, yun yung nag-cause ng stagnation.
Opo.
Kaya yung mga nakatira sa mga malalamig na na lugar, they will always complain of fixed pain. Okay. So can you give us an example that we will usually see in the clinic? By the way, I'm thinking of meron kasi akong sige, mamaya na lang. I hope you all support the acupuncture matters. I'll be coming out with a shortcut approach to shoulder pain. O, di ba? Using the ear, sige lang, watch for it. Ewan ko kung magagawa ko ngayong week. But hopefully matapos natin. Sige po. Ano pa ba yung sinasabihin ko? Okay, yeah. So, number 35.
Number 35. Pain which is alleviated by pressure suggests letter A po, Doc, deficiency syndrome.
So pag nasagot mo yung 35, may sagot ka na rin sa 36.
Yes, Doc. Yung pain which is aggravated by pressure suggests, yung answer ko po is letter B, yung intestinal parasite. Yung letter C, yung stagnation of qi and blood. And yung letter D, yung retention of food or phlegm.
Oo, kasi pag yung pain na aggravate by pressure, excess yan. Or merong pathogenic factor. Dahil ba? Katulad nito. So when you say, may mga tao pag nagpamasahe, gusto nila hard. Kasi, pasensya na, may nakita lang kasi ako sa Facebook. Okay, na-distract ako. But anyway, mukhang bad news. Okay. Grabe talaga multitasking. Sorry po. Okay, let's go back to Di ba may mga tao, lalo na yung mga LMT, no? I'm very, very happy for you kung marunong kayo mag-massage kasi mabilis nyong ma-identify ngayon kung ano talaga yung problem, no? So kung yung pasyente ninyo gustong-gusto ng hard, definitely deficiency yan. Then i-double check mo, tingnan mo yung tongue. So sagot natin deficiency syndrome. Samantala, pag ang ayaw niya ng hard, gusto niya, kung po pwede nga, wag mo hawakan eh. So ito yung mga tinatawag na excess. Okay? Or may presence ng pathogenic factor, or may nangyari. Katulad nito, intestinal parasites. No? This is definitely infestation. Ito na yung pathogenic factor. No? Siguro, may nakain siyang food na may egg or may larva ng parasite. Okay? So this is due to improper yung kulang sa pag nagluluto, no? Minsan pagkagaling sa CR. Kaya you have to be very careful, no? Hindi, wala naman tayong way of knowing, di ba? Okay, then stagnation of qi and blood. So this is excess also. And also retention of food or phlegm. These are all excess. So what about obstruction of channels and collaterals by cold dampness? Are we not going to include it? Anyone?
Hindi.
Hindi po yata.
Relieve.
Hindi siya?
Relieve po yan ng pressure.
Okay. So, gusto nila ng pressure. Ay, okay. Kaya nag-i-improve. Naaalis mo yung obstruction. Okay, very good. Okay, number 37, Ma'am Angel. Thank you.
Number 37. Migrating pain is often due to invasion, letter E, invasion of channels and collaterals by pathogenic wind.
Okay. Ito yung pain na palipat-lipat, no? In fact, when you ask questions, ano ba to? Like, minsan nandito, basta all over. So, that's wind, pathogenic wind, invasion of channels and collaterals. Okay, so I hope that was clear. Thank you very much, Ma'am Angel. Can we call again on who would like to volunteer? Kasi baka, okay, Dr. Sam, can we go? Nawala si Sir AK, nawala siguro yung The others can. Okay, let's go to 38 to 41, please.
Yes, okay. Buti gising pa ako, Doc.
Okay.
Okay, number 38. Post-menstrual lower abdominal pain, which is reduced by pressing and accompanied by scanty reddish menstrual flow. Suggest. So, scanty and then reddish. So that is definitely a deficiency of blood in the liver.
So, okay. Ang kasi dito, di ba, ito no? Scanty reddish menstrual flow. So kukunti lang yung yung ano niya, yung
Kukunti lang.
tapos deficient na deficient kasi
Yes.
pwede mong ma-relieve yung
By pressing.
Post-menstrual. Okay, by pressing.
Mm.
Okay. Can we not answer also, hindi rin po pwede, I was thinking cold syndrome no? Hindi din po pwede kasi wala feeling of cold.
Walang feeling.
Okay, very good. Yeah. So number 39, Dr. Sam.
Okay, number 39, so excess menstrual flow, which is a deep red color and a shortened cycle. The deep red color and then shortened cycle. So ibig sabihin niya mayroon siyang heat syndrome of the excess type.
Deep red,
Kasi
no?
nga, deep red And then yung shortened yung cycle niya. So
madami siya. Excess. Mainit na mainit.
Mainit.
Did you encounter cases like this? Wala pa naman siguro, no?
Wala pa naman, Doc. Ako hindi ko rin na-experience. Joke.
Oo. Baka gusto mong ma-experience soon. But anyway, ang ano ko lang kasi, this is very, very important, especially when we deal with the female patients, no?
Yes.
So you have to be very specific with regards to asking questions, because what I'm trying to determine is the etiology or the pathogenesis ng kanyang problem, diba? So we are going to combine both the Western approach, which is the palpation, and yung ganon. Exciting, diba? So ang maganda kasi sa TCM, meron ka nang naiisip na diagnosis no? Why do we need to know the diagnosis? Because we need to know the treatment principle, right? So these are very, very important. I'm very confident this is already preparing all of us for Kaya since matatapos na rin tayo, if you can really attend, no? Sa 27th of July this month, magkakaroon po ng I think it's all about meridian theory. Dr. Webb will be there to teach you needling techniques and actual location of the points that we commonly use, no? And nag-usap kami kagabi, sabi niya excited nga daw siya ituro yon. I'm not asking you to attend all of them. It's up to you. If you feel that medyo okay na yung ano nyo, but I would really insist when it comes to needling technique, you have to be there para makita nyo yung how to locate the points especially. However, we're going to repeat that when we deal with the channels. That will be our module 3. Channel and acupoint location, the categories ng points, even the extra points. Meron pong, I think, mga 40 to 45 extra points that we have to memorize, and you have to know at least, alam ko, 150 points.
10.
That's according to the latest Pero ang akin lang is if you kaya nga doon pa lang kasi sa 5 shoot points, madami na yon, di ba?
Marami yun, Doc.
Marami na yon.
60.
Yeah,
60 na kaagad, Doc. Yung
40 na lang. Yung extra points pa, 40 na. Hindi ko nga alam kung paano natin yon. Kaya ang ituturo, hindi naman ayaw naman namin mabigla kayo kaagad. Kung kaya nyo lang, kung may time lang kayo, I hope pag yung meridian theory, which is the clinical, you will not be lecturing so much anymore. I think there will just be an introductory, but it will be more on how to locate the points, no? And on the 20th, okay, will be about the vital substances. Are you familiar with the vital substances? Blood, Qi, Jing, body fluids or Jinye, and the Shen. There are 5. Other books sinasabi 4. Sa Pitak 4 lang. Pero we will take up 5. And we're going to study the pathology, like ano ba yung Qi deficiency, ano ba yung Qi stagnation, ano ba yung rebellious Qi. Yeah, yung mga ganon. Blood stasis, blood deficiency, yung mga ganon. And yun, I hope as early as now you can really master. Para it would be very easy na lang. Can you imagine when I look at the ano? Kaya I'm excited because all of you, practically all of you already know a lot, no? So uunahin natin yung TCM then so that it will be very easy. So mangyayari like katulad ng heart blood stagnation, ano ang counterpart niyan sa Western? No, will it be myocardial infarction, mga ganun, coronary artery. Okay? So I hope ito lang kasi no, ito yung pinakamatindi no? So pag nalagpasan natin to, like puro naman tayo diagnosis, 3 linggo na nga lang 'di ba? Kaya so far I'm impressed with how you guys have improved, no? Okay, let's go to number 40, Dr. Sam.
All right. Number 40, kanina ko pang binabasa ito, Doc, which is very, kabaliktaran ito sa 39. So actually, meron dito, a prolonged menstrual cycle with a scanty, light-colored discharge. So it's a prolonged and then scanty. So scanty, meron pong deficient type. And a light-colored discharge, it could be a cold syndrome of deficiency type. Yan po yung answer niyan.
How is it different from the number 39? Okay. This is prolonged menstrual cycle.
Prolonged yung isa.
Short.
It's very opposite.
At saka light-colored.
Light-colored yung discharge.
Okay. Number 41.
Okay. Number 41, premenstrual distending pain in the lower abdomen, which is aggravated by pressure, and a dark purplish menstrual flow with clots. So clots ito, it's clearly a stagnation of Qi and blood.
Yeah. Dark purplish menstrual flow with clots.
With clots.
Yeah. So heat syndrome, shortened menstrual cycles. Yeah. Ang cold syndrome, prolonged menstrual cycle.
Yeah.
Okay. So I hope everybody remembers that. I know it's a bit confusing, but this is very important, especially when you see a female patient, no? So kung napapansin nyo, iba talaga yung approach, okay? So for now, let's focus first. Pero kung napapansin nyo rin, meron na tayong ini-inject na mga points na paulit-ulit, no? Okay. Yes. So can you continue? Sino pa ba? Do you want to continue, Dr. Sang?
Saan po? Okay. Sige, Doc.
42, tatlo na lang. 42, 43, 44.
Okay. Okay. Now, hypochondriac and lower abdominal distension. So, ito. And pain and a distending sensation in the breast suggests. Okay. Ano bang ano dito? Flare up of liver fire. So, deficiency of blood, like hypochondriac and lower abdominal distension and pain. So,
when you say hypochondriac, that's below the ribs.
Yes, Doc. Now, kung titingnan mo, it's something like stagnation, but it's not. So, it's I think the answer is letter D for the depression of liver Qi. Distending sensation in the breast.
Yeah, it's also stagnation eh. Na-depress lang, hindi lang
Qi
yeah, liver Qi constraint. That's another term, liver Qi stagnation.
Stagnation, no?
Oo. So, ibig sabihin, hindi na gumagana. Okay. Number 43.
Okay, 43, dizziness and the standing sensation of the head suggests, so may dizziness na dito. Dizziness. Okay, that's a flare up of liver fire. The standing sensation in the head.
Kasi
So,
umakyat na.
umakyat
Actually,
na po
pag
yun.
involved na ang head, liver yan.
Yes.
Nagde-distend. So, ibig sabihin, lumalagab, lumalaki. Okay.
Parang namamaga sa feeling mo yan, Dok, kasi na-experience ko yun
Yeah.
kasi may pagka-wood type kasi ako.
Oo, lalo na pag nadismaya ka, no?
Oo, Dok.
Number 44.
Number 44, dizziness and numbness of the limbs. So, numbness of the limbs. So that is actually deficiency of blood in the liver. Kasi may dizziness din. So, may numbness of the limbs.
Okay, if you have stagnation of cold, yeah, that's true. Very liver blood deficiency yan. Liver blood deficiency. Kaya pag parang kang kulang ng tulog, hindi ka matulog, eventually you will find numbness or even dizziness, no? What about stagnation of cold in the liver channel? What do you really expect here? Like, ano ba impact ng cold?
Kung may cold sa liver channel natin, Doc, magkakaroon ka ng cold limbs din.
Fixed pain.
There's
meron din siya. Yeah, may pain
There's
po
pain.
kasi as the, ano yun.
At saka narilili pag naglagay ka ng hot compress. Lumalala pag malamig yung panahon.
Yun. Ayaw ko yun, Doc, kasi minsan meron ako niyan.
Okay. Sa ano kasi kayo parating nag-aircon. Maraming salamat, Dr. Sam. I hope you enjoyed so far. And let's call last na si Ma'am Ami. Tapusin nyo na po, Ma'am Ami. Konti na lang, 45 to 50. Very easy.
45, pain in the epigastric region, which is aggravated by cold and alleviated by warm, suggest A, retention of the stomach, which is letter B, retention of fluid stomach due to cold.
So your
letter
answer?
Letter B. Retention of fluid in the stomach.
Okay, that's the best answer, letter B.
Yes.
Cold. Na-aggravate pag umiinom ng malamig, pero nawawala. Yeah. Pag nag-cold, nag-hot compress ka, nawawala. 46 po.
Number 46, pain in the epigastric region accompanied by full belching suggests letter A, retention of food in the stomach. Epigastric region.
Okay.
So, meron na siyang full belching.
Yeah.
Dahil may retention of food.
May amoy, may amoy na lumalabas pag nag-burp, nag-belch, no?
Right.
That's stomach.
Number 47.
Yeah, number 47.
Burning pain in epigastrium accompanied by preference for full, accompanied by preference for suggests letter C, hyperactivity of fire of the stomach. Kasi may burning pain na po sa epigastrium.
Okay,
So,
very easy.
mainit na. Mainit, nagliliyab na.
Naghahanap na ng malamig na
Yes po.
things. Okay, hyperactivity of fire of the stomach. Very good. Let's go to the last one, 48 to 51.
48. Dry cough with scanty or no sputum accompanied by afternoon fever suggests dryness of the lungs due to deficiency of yin.
Okay, alam nyo na ha, ang keyword, afternoon fever, yin deficiency. Pag ang fever niya sa morning, that's Qi deficiency or yang deficiency. Yeah, Qi deficiency. Yeah.
A cough with excessive sputum which becomes more severe in winter and accompanied by anorexia suggests letter B, deficiency of yang of the spleen. So,
okay. Ito na yung lumalala pag winter. So cold na talaga siya.
Cold na siya.
Yeah. And number 50.
Needling with the reinforcing method of combined with moxibustion can be applied to the syndrome of needling combined with moxibustion. Letter B, deficiency of yang of the spleen. Then letter C, deficiency of kidney yang.
So you have two answers here,
Yes.
no? Kasi
Yes,
ito na yung sinasabi ko, pag meron kang kidney yang deficiency, meron ka ring spleen yang deficiency. Nakadepende po sa kidney yang ang spleen qi or spleen yang. Okay? So you have to do tonifying or reinforcing method with moxa. Okay? So I believe you already know what's the bakshu point of the spleen, Ma'am Ami.
Yes,
Bladder. Bakshu point of the spleen. Ako, ano ba yan?
Liver, ano po, bladder 20.
Okay, bakshu point of the kidney.
Ang kidney po, bakshu point of kidney is bladder 23.
Okay. Mingmen vitality of the ano to? Gate of fire, the Mingmen fire. Anong point sa do? Sa governing vessel. I suggest that you really attend 27 ha. Don't let it.
Okay. Okay daw.
GB4. GB4.
GB4 or do 4. Okay, don't forget that. Okay, let's go to number 51, the last item. Finally.
Number 51, acupuncture without moxibustion is best applied to, of course, letter A, dryness of the lungs due to deficiency of yin. Dry na siya, so
you don't do moxa here, just acu.
Hindi na kailangan.
Bakit hindi mo rin gagamitan ng moxibustion yung invasion of exogenous pathogenic heat?
Exogenous pathogenic heat. Dahil hit na po siya, invasion na
Okay, umiinit. So, pwede mong gamitan pathogenic cold. Okay. So, yun, common sense, di ba? So, again, I'd like to thank everyone for joining. Thank you for really staying with us. Kahit inaantok na yung iba. So, tuloy-tuloy lang din po tayo next week, no? Kahit anong mangyari, ingat-ingat lang po. Konting tiyaga na lang. Remember, there are 5 modules. The 6th one would be more purely clinical, no? So, thank you, everyone. And hopefully you can participate sa for this July. That's for module 1. I personally requested Dr. Webb to really teach you sa ano para hindi natin ano kaagad. That's for module 1. For module 2, I'll probably kasi sa tingin ko mukhang alam na alam nyo na. Ang gusto ko na lang makita is how good you are at actual diagnosis. And I'm planning to also include how to do it sa Western medicine, no? Yung ano yung tinitingnan. Okay? So far, so good. So, maraming salamat po. Any questions before we end? So, thank you, mga natira. Yung iba nawala na. Ma'am Angel, thank you very much. Ma'am Ami, and konting tiwala lang. You have to believe that you know. And wag magpapabudol, no?
Yes.
Ma'am Lynn, thank you so much. Dr. Sam, of course. And Ma'am Angel, Ma'am Lane Arandia.
Thank you po.
I will be meeting all of you probably, if not August, baka September. And I'd like to do the diagnostics on you. So we'll give you a case, then, or probably may hilahin ako na tao. O sige, analyze mo, ano diagnosis mo, including the pulse. Sana po, if you have time, you try to review yung, alam ko some of you cannot even join yung 8 to 9, which I understand, but they are all posted on our Acupuncture Matters YouTube channel. So,
Pinapanood ko sa YouTube yun daw.
yeah, and hopefully matutunan nyo rin yung scalp. Siguro for later, doon na tayo focus sa mga channels. And ang gusto ko kasi, every channel you know what are the point categories. Ano yung mga 5 shoe points, ano yung mga back shoe, front move, ano pa, yung mga she cleft, marami pang iba, no? So that's how we will communicate para lahat masaya, no? So with ano pa ba? Any questions? Are you all happy?
Yes, Doc.
So
Yes,
see you
Doc.
again next week. Hindi pa kayo nagsasawa. Okay. Thank you for giving us a perfect score. Okay, so the real test is how well you can do it in the clinic. So we've been doing this for the past 17 or 18 weeks already. And I hope you have matured through, imagine we started March 6, or 4 months na, no? So at least medyo lumawak na yung ating pagkakaintindi. And I would encourage all of you to really practice na sa tongue and pulse kasi this is something that will set you apart from other practitioners, no? So yun. I'll keep you posted with my YouTube. I'm planning to share with you the shoulder pain, the easy way, the fast way, which kasi napansin ko pag ang daming merong shoulder pain, lalo na sa mga missions, no? So this is where we integrate everything. In fact, mas gusto ko pa ngayong ire, no? Mas mabilis. Yeah. Less needles, less points, the better. Faster. Okay, so I hope I have the energy pa. If not tomorrow, baka on Sunday, I'll post it. No? So, any questions from the class?
Ay, Doc, meron lang akong i-share konti.
Sure.
Kasi napansin nyo, marami pong may shoulder pain. And since nag-bone alignment ako, nagbo-bone setting ako. So I just noticed na yung tinatawag na text neck, yung lagi nakayuko, nakatingin sa mga gadgets, that is actually the main culprit kung bakit nagkakaroon na siya.
Yeah.
Yung cervical 1 hanggang 7 po affected.
Oo, itong dito kasi, connected yan. Pati sternocleidomastoid. And there's an area here, yeah. So ang dami, kaya ang daming cases, no?
Yes po.
And then you have to really, ang ano ko lang is, sige, yeah. So thank you for sharing, Dr. Sam.
Opo.
So far, happy naman yung mga patients nyo, no?
Yes, Doc.
So for now kasi, walang legality when it comes to the ear and the guasha, just in case may mag... Pero if you believe naman you can do it, why, go ahead, no ma. Kasi nobody will even question because you can answer all the questions. So yun. So I'll see you again next week. Konti na lang. 3 more weeks to go for Module 2. Then Module 3, that's where the real will start. And then we go to syndrome, pattern differentiation. By that time, dami nyo nang alam. And finally, the last one would be treatment principles and other therapies. So with that, I'd like to thank everyone for joining. Have a great weekend ahead. Ingat po yung mga, may mga ulan. May mga ulan ba sa Cavite? May ulan?
Meron po. Batangas and Cavite po. Malalakas ang ulan.
Okay. O sige, matulog na muna kayo. Maraming salamat po. Thank you so much.
Good night, Doc.
Good night,
Night,
everyone.
Doc.
Ingat po. See you next Friday. Tuloy-tuloy lang. Thank you po.
Okay po, Doc.
Good
Thank
night.
you po.